Greetings, and welcome to What Nobody Told Me After 65. Today I want to talk to you about some of the programs that Congress passed into law that are supposedly to help older Americans with access to mental health care, savings for retirement. That doesn't work for people who've already retired, but it is a good position, a good start. They took place in 2023. Some of them expire, some of them don't. I'm going to try to level the playing field so that you have that information. These bills were passed, these policy items were passed with the intent to help older Americans keep up with inflation and keep up with the rising cost of housing, etc. So let us start with Medicaid. Medicaid has a program called Medicaid's Money Follows the Person. It's a program that helps spouses who are affected by their loved one's medical situation. And it is a program, the protections have been put in place until 2027, which means it has to come back and get looked at again and refunded. But it allows a spouse to get some relief under Medicaid, not Medicare, mind you, under Medicaid, because in the past, in order to be covered, you had to buy into the program if you were not the affected individual. Remember, Medicaid is for people who do not qualify for Medicare. Medicare is for senior citizens. Medicaid is for everybody else. They didn't make this initiative into this Medicaid's Money Follows the Person program permanent. It has to come back again in 2027. And when I get more familiar with it, I'll come back and explain that. Mental health support was increased to cover behavioral health services, which include marriage and family therapy, and licensed mental health counselors. And apparently there is a growing need for this type of coverage, and that's under Medicare. Also, telehealth services were expanded. They provide for 2 additional years of Medicare telehealth services. I'm currently using telehealth. I find it to be very helpful that I don't have to leave home. I can access my provider on my mobile phone, in my car, sitting in the parking lot. It really comes in handy, and it allows for disabled seniors not to have to worry about transportation, which I had told you earlier. It has become a growing concern. You can't even get to an appointment. So telehealth has really become more prominent of late. And as long as you know how to work your phone, that's another issue, because you have to sign on to a portal in order to receive these services. And if you can't work your phone, you can't access telehealth. Perhaps social service agencies might come into play when an individual needs to have a telehealth appointment and can't access their phone. Maybe they'd be able to be assisted by a social worker. Now, there were some reforms put in to help Americans save for retirement. Doesn't help those of us who've already retired, but it sounds like a good plan. The bill has restructured the tax credit that they made available to certain workers, changing it from a credit that was paid in cash as part of your tax refund, and they turned it into a matching contribution that should be deposited into the taxpayer's bank account where their retirement plan is being held, or into the account where the employer is holding the employee's IRA or retirement plan. The match from the federal government phases out between $41,000 and $71,000 for single taxpayers. If you're filing jointly, it phases out between $41,000 and $71,000 if you're filing jointly. If you're a single individual, you can expect a federal match of $20,500 to $35,500. I would suggest that you speak to your tax person, whoever's helping you file your taxes, about this credit, particularly if you are still working. New emergency savings incentives will allow for a penalty-free withdrawal of up to $1,000 from your retirement accounts to cover emergency expenses. And of course, there will be limitations on what they consider emergency expenses, but it's worth looking into. Starting in 2025, if you're a part-time worker, employers have been instructed that they have to allow a part-time worker to join in a retirement plan within 2 years of being hired. Right now, it's at 3 years of being hired. That doesn't start until 2025. The Act also establishes a national lost and found database for retirement accounts within the Department of Labor to ensure that people don't lose track of money that they may have earned and then they moved away or retired or what they've done and lost track of this money that might be available. So there's going to be a national lost and found database where you can find out if you have money sitting in a dormant retirement account for which, if you don't apply for it, it goes to the state's coffers. Doesn't make sense to me, but certainly that's a step in the right direction. The Act also provides provisions for some penalty-free withdrawals out of your retirement account for terminally ill individuals and victims of domestic violence. And it doesn't allow, these services are not ongoing. Some of them have a expiration date. I'll check more into when they expire and what has to happen on the individual front, where we have to talk to our congresspeople and those folks in politics and say to them, these are things that are important to us and we need them to continue. We have, under the public health emergency, when the pandemic was in place, there is an end date for pandemic continued health insurance coverage. During the pandemic, people were getting sick, having to go in the hospital. They didn't have any coverage. There was money set aside to cover people who were affected by the COVID-19 pandemic, and it was emergency monies, and I don't know how long this money will last, or even if it's still in play. I did take a look at how much money was appropriated for different types of services. I noticed there was over $200 million appropriated for taking care of your disabled loved ones. If you've been watching the television, there are ads, hundreds of them, where they pay you to learn how to care for your disabled family member. If it's your mom, your aunt, your grandmom, your uncle, you could apply to these companies and get paid to take care of your family member at home. $200 million was appropriated. That's why we see the increase in the number of organizations that have just popped up. Learn how to take care of your loved one at home. There's a reason why it's so much of it. These folks are very smart. They look at the amount of money that's just sitting around out there that has been appropriated for certain services. They figure out which ones are lacking, and then they jump on it. It's the same thing with them calling every day trying to get you to get an Advantage card, the one that gives you money to purchase over-the-counter medicines, things that don't need a prescription, to buy groceries, to pay an electric bill. These cards come with a certain amount of money on them that you can use toward these items. It's become very popular. You're getting phone calls. They're trying to get you to switch over. It's become competitive because so much money has been appropriated for that particular service. And therefore, it just makes sense for a smart guy to just pop up a company, and that's what they do. Really haven't had any training or anything. They go and match people together. They match people in your family with an organization like the Easter Seal Society or one of those organizations where you get training on how to care for your loved one, washing their dishes, taking them to appointments, making sure they take their medication, making their bed, doing light housework, and that type of thing. Things that typically family members who have aging or disabled individuals in their family, usually family members just agree, to help, not knowing they could get paid to do this. And now they know. And it has become a booming industry. They did put some money in for the LIHEAP program, which is the emergency heat for winter and for summer when your rates go up considerably. About $6 billion was appropriated into the LIHEAP program to address the growing cost of heating fuel in the winter and to prepare for the summer cooling season. $42 million increase in the Section 202 housing for the elderly. We'll get more into that. I'll give you more information. And there was a $15 million increase, or double. So it must have been $7 million previously, but they've doubled it to $15 million. Aging in place home modification grants. Grant means it doesn't get paid back. So if you apply to this program and you're approved, it's a grant. You don't have to pay it back. And this is so that seniors and folks with disabilities can age at home gracefully, as opposed to being in a nursing home or a assisted living facility, which costs quite a bit. So even though they put the money in these programs, they're not fooling anybody. It's to save money on the other end because it costs a whole lot more to put you in an institution than it does for you to stay at home. I hope this information has been helpful. We will continue to talk about the National Center on Aging, which is my go-to resource. They keep us informed and let us know what's happening with that Older Americans Act. If you find this information helpful, please respond in the comments below, subscribe, and share. And remember, you don't know what you don't know. Thanks for listening.